wake of the pandemic, countries around the world have urged older people to self-isolate for weeks, of course, in order to shield themselves from the disease. But now an international charity, HelpAge, has warned that more should be done to protect the elderly in order to prevent the coronavirus developing into a global humanitarian emergency, particularly in conflict-affected countries. Joining me now is the Chief Executive of the charity, Justin Derbyshire. Good afternoon. Thank you for your time today. So, first of all, do you feel the elderly are being discriminated against?
Currently, no. I mean, I think the attention that you're seeing, particularly in European states, has been fantastic in terms of the focus that we see from communities and from government on older people and people with weak immune systems. I think what we're concerned about is what we're seeing from the UN system and what we're seeing from British government development agencies and other European agencies, that this approach across the world in responding to this humanitarian disaster that is unfolding, it has to focus on all of the communities, but specifically with interventions that help older people and those with weak immune systems.
So what countries do you think are particularly affected, or they might not be getting as much help as they should?
So, I mean, this is a potential unfolding catastrophe in the lower income countries. Countries such as Ethiopia, Pakistan, where we know that they don't have the health infrastructure that we have in Europe to be able to support them. I mean, for instance, in the UK, we have about 3 doctors to every 1,000 people. In Ethiopia, they have 1 doctor for every 1,000 people. Imperial College is estimating that the demand for hospital beds in lower income countries such as Ethiopia will be outstripped by a factor of 25.
What are your concerns then if they don't get the care needed?
If they don't get the care needed, we're going to see huge amounts of people, unfortunately, dying of this tragedy. We're going to see, Imperial College has estimated that even with basic mitigation, we're going to see up to a figure of around 20 million across the world. And the particular concern is in states such as Syria, where you see the conflict unfolding, and in places like Rohingya camps in Bangladesh, in Cox's Bazar, where we expect a higher transmission rate because of the high population density and the close proximity to each other that the refugees are kept in.
And who's to blame for this? Government inaction, or the fact that, as you mentioned, there are a lack of healthcare facilities?
I mean, I think you're looking at it in terms of 2 things. You're looking at the situation now, and there's not enough action happening from the international community. There's not enough action happening from the development departments to support an immediate response that has to happen to be able to build awareness, prepare medical facilities, and then provide communities to support older people and those with weak immune systems now. But you're also not seeing the funding that needs to come through to international NGOs and national NGOs to be able to respond to this. We've got some funding to support, and we're carrying out a project with our partner SEMA in Idlib in northern Syria, and we're providing basic medical equipment. We're trying to build isolation wards, and we're trying to provide them with the medication supplies they're going to need to be able to deal with this, but there isn't sufficient at the moment. And what we're seeing already is a potential catastrophe unfold across these countries that are already dealing with huge problems.
I mean, getting funding to people who need it is traditionally a slow process, isn't it? And of course, this disease has caught many countries on the hop. It spread so rapidly.
It is, but we do have facilities to be able to act quickly. The British government has put in funding. We have the Disasters Emergency Committee in the UK, which can do an appeal. We do have a UN system there to react to these humanitarian disasters quickly. So it can happen. It just needs people to focus on it now and ensure that response is dealing with all of the community, but specifically around the older people and those with weak immune systems.
And the money specifically, quite often we hear it's all bogged down by red tape getting to those who need it.
The funding challenges in the humanitarian system are being resolved each time, actually. And you've seen some really great improvements to ensure that it can get directly to local actors. And HelpAge International supports a network of over 160 organisations in 90 countries. So we're very focused in having systems in place to be able to allow these people to respond in their communities within a week.
Is it up to individual governments to do something, or governments in full, a whole, as you say, international community perhaps coming together?
I think you need both. You've seen the Secretary General of the United Nations has already written to the G20, and he has asked them to come together to be able to respond to this global catastrophe. So that's one thing you need. You then also need the OECD countries, the European countries, to be able to look at what they can do, both in sharing resources but also lessons learned from this crisis. And then you need the British government, which has always played a huge role in humanitarian responses, to be able to mobilise its resources, both people and funding, to be able to act now in the next week to start to support the action, particularly in sub-Saharan Africa, in Ethiopia, in Kenya, but also in particularly these conflict countries such as Syria and in refugee camps. Otherwise, we are going to see a huge amount of deaths, and particularly affected will be older people and those who have already got weak immune systems.
All right, powerful message. Justin Derbyshire from HelpAge International, thank you for your time today.
Thank you.